Hi guys, welcome. I hope all of you are looking into the videos of the PSM resident class. If you're not, I guess you're missing out on this. And this particular video is on a very interesting topic which you must be knowing. And if you don't, just watch this video and enjoy the video. If you have any queries, any doubts, or any particular topic you want me to teach, you can just drop me a message on my WhatsApp number. The details are given below. Yes, guys?
So hello, good evening, my dear students and my colleagues, my teachers. Today we are going to have a discussion with one of my students, now a colleague, Dr. Oindrilla Mandal, who is a second year PG student, and she has done a short study which is a qualitative research under the guidance of Dr. Ritu Ghosh ma'am, who is an associate professor in the Department of Community Medicine. So hello, Dr. Oindrilla, good evening, and
Hello,
thank you for giving your valuable time. So any quick comments from your side on your experience with quality research first?
It was a very nice experience. I can proudly say so, because before I actually did this study, everybody had done only one thing, scared me. And even when I had myself read about it in books, it felt very scary. But once I did it, it wasn't that bad an experience, and rather it was a very nice learning, comprehensive experience. So I would like to encourage everybody to do it.
Okay, so what was the scary part everyone used to tell you?
The most scary part is it's very difficult to analyze, but it is not so actually, because it's a very methodical way of analyzing it. You just have to be clear and means about the how you are going to proceed with your study. If you are clear in your mind how you're going to go ahead, you know that which way you will analyze, which will be analyzed first, which will be analyzed consequently, or whether it will be done simultaneously. So that is all dependent on the type of your study, the nature of your study.
Okay, excellent. Chalo, let us start. Over to you. You are now our teacher, so please go ahead.
I'll try. Well, my study, the title was, it's a menstrual hygiene management, the status, the enablers and barriers among the late adolescent school-going girls in Baharampur municipality, West Bengal. This study was conducted in West Bengal, and this was conducted among the school-going students, among the late adolescents. Now, this study, the topic is a very common topic, menstrual hygiene. There a lot of work has been done. But the only reason of taking up menstrual hygiene was we had noticed that a lot of students was having a lot of school absenteeism. And when we inquired further, we got to know that it was mainly related to the menstrual issues or menstrual disorders or everything else. And there were also associated factors. So we decided to delve a bit in depth into it as to what are the actual factors or what are the main barriers or problems or enablers, again, not only barriers, otherwise it would have been biased. So to find out the original causes, and that is why this is not a qualitative study, but it's a mixed method study. Now the objectives were very clear. I would like to come back to the objective. Yes, thank you, sir. To assess the practices that is related to the menstrual hygiene management among the school-going adolescent students. And we had taken the late adolescents, that is 15 to 19 years in Baharampur municipality. Since we know already that menarche onset is different in different people, so we wanted to have all the students, at least the menarche should have set in, otherwise the topic would not be related to them. Second objective was to identify the correlates of the menstrual hygiene management among the study subjects. Now these two objectives, these are primarily the quantitative kind of objectives where we quantify that what are the practices or what are the correlates that is coming into it. But the third objective is the qualitative part that we have added to explore the enablers and barriers of the menstrual hygiene management from the participants' perspective. Now, whenever we are doing any sort of qualitative study, then we need to have a perspective. It can be from the observer's perspective or it can be from the participant's perspective. So in our study, it was from the participant's perspective. Coming to the materials and methods, since this was a mixed method approach, so it was incorporated for assessing both the quantitative and qualitative component. Now, the quantitative part was a descriptive type of study, just like the most of the studies that we generally do. But the qualitative part, it followed a concurrent design approach. Now, I would like to say few words about this word. The concurrent design approach, it means that both the quantitative as well as the qualitative part, they are dealt together parallelly, simultaneously, so that whenever I am looking into the quantitative part, I am also looking into the qualitative part. It's not that one thing is seen and the other will follow. There are two more designs, that is explanatory and exploratory. These are sequential type of designs, sequential type of approaches, to be more specific. When I say that this is a, sorry, I forgot. When I, sir, can you please?
No issues. We'll come back to that. We'll probably discuss on that later. Okay.
Okay. Yeah. Okay. Yes. Okay. I remembered. When we talk about explanatory type, then it is always the quantitative part that is done first, and then it is followed by the qualitative part. But if we say exploratory, so there is something to explore. So we always check onto the qualitative part, followed by the quantitative part, to tally that whether the results are fine or is any more findings coming out. Now the study setting was school. So it was a school-based study for us. The study duration was less since it's a small, short study. It was of 6 months duration. And the population were the adolescent girls in the public secondary and high secondary schools. Now coming to the inclusion criteria, this is very important and it is applied for all the studies or whichever research we are doing. That is, there has to be a population that we include and there has to be a population that we do not include, that is we exclude, and that has to be based on certain criteria. So for the inclusion, it was the late adolescent girls who are enrolled in classes 9 to class 12 in those selected public secondary and high secondary schools of Baharampur municipality. And also the students who had attended Menarche at least for a period of 3 months, because otherwise the factors, whether enablers or barriers, could not be well understood, because initially everybody has a problem. So at least a 3 months period was considered for them. The exclusion criteria was the students who did not will to participate and also those who remained absent during the data collection visits. Coming to our sample size and sampling technique. Now for the quantitative part, we apply the sampling size, and it was done by seeing a similar study. They had a 36% of adolescents who used the hygienic absorbent, and using that we used the sample size formula with 95% CI and 10% absolute precision. It came out to be 89. A design effect was applied, and along with it non-response rate all was added, and finally it showed to be 196, and the final size that was covered was 204 for equal distributions. For the qualitative part, this part is very funny, because for qualitative there is no formula. So the only formula that exists is data saturation. That is, whenever we are asking question to our participants, we go on asking question. It's an iterative process. Iterative term meaning repetitive. The sir had said this in the previous video of our classes. And once we get to see that the answers that are coming from the participant, they are same, they are being repeated, then we realize that yes, the data saturation has taken place, and hence we stop there. So for our case, we saw that the total of 8 IDI, that is in-depth interview, were done, and it was stopped after that as data saturation was reached. Coming to my sampling technique. Now again, sample size, sampling technique, both applies to quantitative studies. So this is for the quantitative part. The multi-stage random sampling was done, but there was a problem. We couldn't avail the class 12 students because the duration of the study fell during their board exams. So we had to take equal number of students from each classes of class 9, 10 and 11. That is how the sample size was achieved. Coming to a qualitative part, this purposive sampling technique was followed to include the required participants through a flexible approach, and data collection method was applied till data saturation was reached. Now, I would like to say what we meant by the purposive sampling. It was that since we had done the quantitative along with the qualitative, so we got to see that there were certain regular attending students who were coming regularly, who are well spoken, who could express themselves well, and we purposely selected those students so as to get a better outcome of our IDI. 2 criteria were specifically considered. one criteria was that it should represent, the selected student should represent all the classes, because the mindset, the barriers or the enablers, that may vary class wise. So that was one thing. And the other was they should have been regular attendees, because if they are not regular attendees, then a lot of problems get skipped. So that was another thing. Coming to tools and technique, the quantitative part. Now, the quantitative part was dealt well because the tool was the pre-designed and pre-tested self-administered questionnaire for collecting the data from the study subjects. Whereas the technique was the data was collected through the self-administered questionnaire. That is, the question papers were given to them and they answered, they returned it back to us. And it included variables that regarded their background characteristics, their knowledge and practices regarding the menstruation, and also the menstrual hygiene management. Because the background characteristics was considered specifically because of a very simple reason, that a lot of menstrual practices are being governed by one factor, and that is the financial condition or the socio-economic status of that particular child. So this was specifically considered. For the qualitative part, there were two tools. One is the IDI guide. Before conducting any interview, it needs to have the guide. As sir had said in our previous class, that for the guide there will be an opening statement. We greet the person, the respondent, and then we open it. Then we become comfortable, and then we start asking questions. Give 1-2 questions, put some probes, and then again when we end it, we thank. And then we summarize, and we also say that you have anything else to say, so that if there is anything more, because the entire purpose of the qualitative part is to explore. So if there is anything more you want to add, all that. So all that is put in the form of an IDI guide, and that was prepared with the help of experts, and that one specific guide was used for all the IDI that was conducted. And obviously, whenever an IDI is conducted, there has to be some recording, whether audio or video. Most of the cases, since video becomes a bit difficult or unacceptable, so audio recording was done in our case. For the qualitative part, the in-depth interview of the purposes that participants were done for exploring the enablers and barriers of menstrual hygiene management. These were the operational definitions that we used for our study. This varies from study to study or the setting that we are working on. So we may move. The data collection. Now, this was collected after the ethics approval and everything, and also when we are doing in a school setting, the permission of the schools need to be taken. And finally, the data is collected from the study subject from their respective classes. It was taken. So for the quantitative part, and for the purpose of the study was briefed to them, and then the data was collected. And after the data collection of the quantitative part, the students were considered for the qualitative part, and they were taken, and they were separately asked, the interview was taken. Now, this was for the quantitative part, that school were approached, data was collected. Prior to data collection, questionnaire was translated into the vernacular language. The study subjects were briefed about what they are supposed to be answering today, and the selected studies participants, they were given the questionnaire. Now, one thing was done while doing the quantitative part, that is, care was taken to minimize discussion among the students, because otherwise they'll be copy pasting. So that was a bit tried, and because everybody's individual views or everybody's individual personal inputs was required. So we tried it that way. For the qualitative part, the idea was conducted among the selected students where their assent was taken. Now, assent is very important, specifically when we are doing a qualitative study. Help from the teacher was sought while identifying the proactive, cooperative and communicative girls from class 9 to 11. As I said, that it was a purposive sampling. So we had specifically chosen those students who could express themselves well, or who could tell us the problems or issues, whatever. Now, the IDI, it was conducted in an empty classroom within the school premises using the guide. Probe was given, interview was recorded with permission. Next was management and analysis of the data. Now, for the quantitative part, it was checked for completeness and consistency, entered into Excel by using SPSS. It was analyzed. proportions in relation to different variable outcome, it was seen. For the qualitative part, now that we had recorded the data, now we have the audio tapes, now it is transcribed into a document that is known as verbatim. That is, verbatim is word by word as said. The text transcripts of the data were prepared in verbatim. Now the content analysis was done through identification of codes and themes. I would explain it further. Once I get all my verbatim, all my transcripts, I had done it manually. It can be also done with the help of a software like NVivo. It could be done, but I had done it manually since it was only 8 IDI. So once we get the transcripts, we start reading. Once we start reading, we start to mark the keywords. Once we get to mark the keywords, we start generate a code. And once those codes are generated, then we get categories. From those categories, we get to see, okay, so where is this category leading to us? Towards a particular sub-theme, that maybe there is school absenteeism, or maybe there is, delaying in coming to school. And what is all this leading to? That will lead us to our main theme. So that is how this step-by-step process was done, and this data analysis was done. Now the data was recorded, audio taped and transcript. The transcripts, yes, through identification of codes and themes. Now this is the result of the quantitative part. For the quantitative part, we could see that there were age. Now age was 15, 16 and 17 and 18 because it was 9, 10, 11, this age group, class 9, 10, 11. So you could see that there were mainly students from 15 to 16 age group. Then again, religion wise, mostly were Hindus. Again, from caste, mostly were general caste. They did not belong to any reservation category. Education of the father was important. Education of the mother was also important, because for menstrual hygiene, it is not only the education and awareness of the child herself, but also the parents, because that influences the practices and the knowledge of the child. So this was considered. Also, the occupation was of father was considered, occupation of mother was considered, for very simple reasons, because the occupation of the father, it served the very main purpose of the earning part, because if the father is not earning sufficient, the child will be more compelled to use a cloth or a used material, in spite of having the awareness that no, she should be using some sanitary napkins. For occupation of the mother, it was important because homemakers, which was almost 180, a lot of people, it was easier for homemakers to help the child and guide the child more compared to working mothers who are away from home. Also the type of family, because in joint family, the privacy was a factor that played an important role. Coming again to the socio-economic status, yes, everything trickles down to that. Next. Now, this was about the awareness of the study participants about the menstruation as well as menstrual hygiene management. That is, what was their knowledge, what was their idea about menstruation. This was important especially for those, the class 9, 10, those who have just started to menstruate or who are in the initial years of menstruation, who haven't had much knowledge and much experience about it. So the sources of menstruation was considered, and it was very surprising that yes, nowadays schools have had a lot of awareness programs and teachings, that lot of the students could say that yes, uterus is the place of, source of menstruation, because in previous studies we have seen that many couldn't say. Some said bladder, some said stomach and other things. Now the cause of menstruation, it is still not clear, but anyways, many students said that it was removal of the unwanted blood. The age of menarche, it was mostly 14 to 16. The type of absorbent to be used, it was sanitary napkins, 199 students said, whereas cotton pad was said by 5. Now in my study, I would like to highlight that it's very surprising to me that all these students, it was 100% of the students who used hygienic absorbent. This was definitely not, for me, it was seen in some other study, but I found it in my study, which is very, very encouraging and nice for me. Now, cost of low cost sanitary pads. Now this is because under the scheme, government schemes like Sabla and others, where, free days, the free day scheme, where the students could avail the adolescent girls could avail. So that is why this was also asked, that whether they are aware of it or whether they are aware of the price. Okay, now the use of absorbent, as I said, that all said it was sanitary pad. Now the length of use of absorbent, this is again important because as per the menstrual hygiene scheme, their management, their details, they say the appropriate it is 4 to 6 hours is considered proper, and less than that or then more than that is not proper. So they even had different responses. Again, cleaning of external genitalia less than 3 times or greater than equal to 3 times. This is again a concept that many students did not know, which was further explored while doing the IDI. Disposal of the used pad. Now this is again one of the very important barriers that surfaced while we did the IDI, that many students found it very shameful, found it very difficult as to how to dispose that pad, and in that shame, in that worry, they avoided going to school in those days of menstruation. So this was again a finding that we found. Coming to the menstrual hygiene management characteristics that were related to school. Now, the main characteristics that was related to school we found was availability of continuous water supply. Because if there is not continuous water supply, whether it was present or absent, accordingly the students said. Whether there was adequate space for changing, again that was important. The privacy for changing, the hand washing facilities, the sessions about menstruation. Now this was a very important thing, and any absenteeism, and it was huge because 170 students, they reported absenteeism. These were the factors that influence menstrual hygiene management. Among them, we could find that the education of the mother was one of the significant factors. The occupation of the mother was one of the significant factors. The socioeconomic status played an important role, and also the disposal facilities. This also turned out surfaced as an important factor. Now, these were the findings from our quantitative part. Sir, you may proceed with this part because this is the explanation of the tables. Yes. So, sir, please come back to the previous one. Pi. Thank you. Now, 3 of the 4 components of the menstrual hygiene management has been considered as an appropriate menstrual hygiene management. Like when we started to describe that what is a menstrual hygiene management, then there were 4 things that we had considered. Sir, can you please go to the next slide? The next one. So the previous. Sir, please wait. Yes, sir. Wait, sir, wait. Yes. Now, those 4 things were, 1, that there has to be use of a proper absorbent. That was 1 criteria. The second criteria was the duration should be at least within 4 to 6. Third criteria was that at least greater than 3 times the external genitalia need to be cleaned while changing. And fourth criteria was there had to be appropriate disposal in covered bins. These 4 criteria were the criteria, as these are also as per the WHO, considering menstrual hygiene management to be proper. This is what we call as the proper. Now, from our study, we considered that of these 4 criteria, at least if we get 3 criteria, we'll be saying yes, okay, fine, they have a good menstrual hygiene management. And it was very surprisingly very shocking that only 11.3% showed this appropriate menstrual hygiene management, which is extremely low. So you may proceed to the next slide. To the next slide again. Okay, now we came to see that there are certain reasons for absenteeism among the school study participants, and it showed that some had heavy bleeding, some had low back pain, some had abdominal pain, and some had multiple reasons. So there was huge amount of absenteeism that was found. Now, unfavorable menstrual hygiene management was higher among those who reported their mother's education to be below secondary, homemakers compared to working mothers, and among those with absence of disposal facilities. All the study participants reported that they had adequate privacy and disposal facility at home. Because while we were checking the menstrual hygiene management, it appeared in two settings. One, they were having the menses at home as well as while they were going to school. So while they were having it at home, surprisingly, everybody was fine because most of the students did not have any problem. The main problem occurred when they were at school because the school settings were different, and also in school there were certain factors, certain barriers that hindered their menstrual hygiene management, and that is what surfaced in our results also, that at home everything was fine, but also at the facilities also for few students who resided in orphanage, they also had proper disposal facilities. The favorable menstrual hygiene management has been considered if the hygienic absorbent was used, cleaning of external genitalia at least more than 2 times, proper disposal, and education about menstrual hygiene management. For the qualitative part, now the results. Now the IDI that we had done, the verbatim that the transcript that was made, it all showed that first about the perception regarding menstruation, their level of awareness. The study participants, they were aware that it is a natural physiological process and had got some relationship to motherhood in future life of a girl. This is all they knew from their level of knowledge. Coming to openness with parents, 3 IDI participants indicated that they were frank about periods with both their parents, with their fathers being aware during that phase and taking care by providing hot water or bringing pads, etc. Whereas 4 participants think that it cannot be shared with their fathers, and hence they restricted it and just kept it to their mothers. One participant who resided in an orphanage mentioned they did not discuss about it with anyone, and I was the first person she spoke about it to me and opened up. Coming to the enablers, that is the factors that helped them practice proper appropriate menstrual hygiene management. First was a conducive environment, especially at home. None of the participants indicated that they have any problem in managing menstruation at home. One girl mentioned she faces problem in managing periods when she goes to a native's home, that is like native place, where she is compelled to share the toilet with many other relatives. Now all the participants indicated that toilet facilities were available in their homes. The girl living in orphanage also mentioned that they had separate washrooms for changing their pads, and all the participants had access to continuous water supply, hand washing, and disposal facilities at home. Support and care from the parents added to a more congenial environment. This is evident as in one of the IDI, the participant said that I am pampered with hot bag and chocolates and mainly stay at bed rest during this phase. The next thing was discussion with parents. Now, 7 out of 8 participants mentioned that they discuss about menstruation with their mothers. The girl from the orphanage had a sensitization program organized by an NGO, whereas 3 of the participants said that they are open about menstruation with their fathers as well, and that they can request their fathers to buy pads or sanitary napkins for them as well. It is seen from one IDI participant who said, it means what is so hush-hush about this? This is a very normal and natural phenomenon that happens every month to every single girl. The third theme was access to hygienic absorbent. Now this is again a very important factor that decides the management, that whether the person will be able to have an appropriate menstrual hygiene management or not, because if there is no availability, if there is no access, then it becomes an issue. So all the participants mentioned that they used sanitary pad during menstruation. The pads are procured by their parents, mostly mothers. 3 of the participants indicated that they tell their father to buy. Also, sanitary napkins are available at school. Now, there at school, it was seen that yes, there was a pad vending machine which disposed pads on giving certain amount of money. Some school it was 5 rupees, some school it was 3 rupees, whichever way, but there was machine. Also, they were available from the school with designated teachers and given to students if required at a price of ₹5 after availing. So it depended, it varied from school to school, but there was this provision. Next theme, was access to washrooms with water supply at school. Now at school they had washrooms with continuous water supply and hand wash facility like functional wash basins and adequate spaces within toilets. Coming to the barriers. Now the main barrier was unhygienic washroom, because all the participants opined that the washroom in their schools are very unhygienic because it is made unclean mostly by the students themselves only. Hand wash is not available near the wash basin. It is dark inside the toilets, causing difficulty to change. The overall environment is not at all conducive for changing pad, and hence many of the students refrain or avoid school during the first 2 days of their period, especially the days when they have the heavy flow. One of the IDI participants said that toilet use korte thik shubidhejonok lage na. It means I do not feel comfortable to use the toilets for changing. The second participant said school e bathroom e kon tissue thake na. It meant that there was no tissue or any soap or any cleaning material present inside the washroom. That is, after they are changing, they have nothing to wipe their hands on. Inappropriate disposal facility. This was again a problem. The participants are not satisfied with the disposal facility at school. In one of the schools, the used pad had to be carried outside the washroom for disposal in regular bins, for which they refrained from changing pads in school and tend to remain absent. Because from the school bathroom, they had to walk through the entire field, or there was some playground, and then go into another corner, and then they had to dispose it there, which is very humiliating, shameful, and difficult, uncomfortable for them to do. So they preferred staying absent. Long hours of school. Now this became a very big problem, especially during the initial days, the days of heavy bleeding. Most of the participants mentioned that they had to stay in school for at least 6 to 7 hours. Therefore, it became very difficult to sit at a stretch in a class, especially during the first 2 days of periods. Therefore, if it was not absolutely necessary, like examination, then 6 out of the 8 participants preferred avoiding school during the first 2 days of menstruation. These students mentioned that they usually attended their private tuitions during menstruation because the duration was short. So they preferred going to tuitions but not schools. Then lack of awareness session on menstruation. Now all the participants mentioned that there has been no awareness program on menstruation and menstrual hygiene management. Only it has been taught in 1 or 2 biology classes, and one of the participants in Vishnupur Girls School mentioned that there was session on menstrual hygiene management, but then she remained absent. Somehow she missed it. But as we had gone to do the IDI, we noticed that although if there has not been any session, there were certain posters, and the posters were in vernacular language. They were present, they were based on menstruation and also about the management, how to manage. But 3 out of 4 of the participants, they did not have a look. The girl who went through the poster, they were unable to understand the scientific term which was written in Bengali. Like it was written Ritushrab ki bujhte parini, she said. So Ritushrab in Bengali, in English it means menstruation. So she couldn't understand the term, and therefore the poster couldn't impart the knowledge that was meant to be given to them. So concluding, these were the themes that we found. This present study revealed that 21.56% study participants had appropriate awareness regarding menstruation and 11.3% had favorable menstrual hygiene practices. The current study reveals about 88.7% of students from selected schools of Berhampur municipality had significant correlates like education of mother, occupation of mother, socioeconomic status, and disposal facilities at school, which influence their menstrual hygiene management. 83.3% were absent from school mainly because of physical reasons. The menstrual hygiene management was favorable in home setting, but it was inappropriate in school setting in few cases. From the IDI, it surfaced that at home, they practiced timely changing with proper toilet facilities, while the same was hampered in school setting, thus causing inconvenience and hampered in school, and hence absenteeism from school. Tendency of school absenteeism appeared a major constraint as the environment wasn't conducive enough for the menstrual hygiene management.
It was really great to actually discuss this particular findings. Now I have a few questions for you. The first question is, you mentioned that you had actually taken an assent. So can you tell us why not a consent, why a assent? from the ethical perspective?
Because consent is mainly considered for 18 years and above. So since the students considered belonged to the age group of late adolescent, that is 15 to 19. So and we had most of the students belonging to 15 to 17. So it was mostly assent.
Okay. Now coming to the second question. Now you brought out a very interesting fact that majority of the students, mother was almost having a good amount of education. They were housewives. But still you saw that out of the 4 components of the prescribed by the World Health Organization, the score was only hardly 11 or 12% out of 100. So how do you actually match that? Because on one side you say that the mothers are having a good education, which is favorable for menstrual hygiene. On the other side, you say they are housewives, so they are supportive. Even you brought out it in Quali that even the parents, that is the father was also supportive. But still on WHO scoring, the value actually turned out to be low. So how do you explain the paradox?
It is mainly because of the other components. The one most important one that played a very crucial role was the disposal. And secondly was the duration, the school duration that prevented them from changing at appropriate time. Also, that cleaning of genitalia, this was also hampered because even there was constant supply of water. We even found that at places in IDI also the students mentioned that there wasn't sufficient tissue, or maybe the hand wash was not enough. So that cleaning part was a bit, it was hampered. Okay. So that is why the total score came down.
Okay. Now, this is a very important point which you brought out. Now, if, and this is for all the audience over here, if our dear colleague would not have done a mixed method study, she would not actually have been able to explain this paradox. And that is probably the importance of a mixed method study, which she has beautifully brought out over here. Yeah. Now, one more aspect. Now, if you look generally, we have an understanding that, okay, the menstrual knowledge score is low in our country because we are more into still looking into the traditional practices of menstruation. But over here in our study, actually it has come out that the knowledge score has gone up. Again, yes. What do you think is that reason of a change where the knowledge score has gone up? Do you think that the government plays a big role, or it's some other factor which is actually promoting for this positive shift?
I think there are two very important factors that can contribute. One, we cannot just deny it, that is the government, because the government over the years, they have taken very good initiative and very rigorous initiatives, as well as continuous monitoring and updating all these programs, especially now that we have for adolescents, their adolescent friendly health clinics, everything. So everything from adolescents perspective, there has been a push from the government's end. Also, another thing I personally feel when I have interacted with these participants is social media, that their awareness level has increased. So maybe everything has contributed little, and we have seen the effect that yes, there has been an increase in their overall awareness.
Okay. Now, a couple of critical questions over here. You mentioned in the exclusion criteria, those females who were absent from your school were actually excluded from the study. Don't you?
No, I mentioned that.
Yeah.
There were certain visits, like since we had to work in a particular time frame, so maybe every school there was 2 or 3 visits. So student who was absent in all the 3 visits, we had to exclude them, because otherwise it will be a random assumption.
But don't you think you should explore on a student who has been absent for all the 3 visits? Because your timeline, as I remember, was around 5 to 6 months. Imagine for 5 to 6 months for all the 3 visits, a student is absent. One reason is she has dropped out from study. So I think when we do a study later on, probably, you should actually explore the reason of this exclusion, because that might be a very big barrier which has come out, which we probably missed in the study. It might be. It's again that
yes, something can come out.
Yeah. Second question I had, you mentioned a very good point about one girl from the orphanage. And she had mentioned that there is a separate washroom in the orphanage for changing the sanitary napkins. Now, yes. Is that a co-ed orphanage? Like boys and girls both?
Okay. No, only girls. But since Still, I would say in India that menstruation or the days of menstruating is considered as an impure thing or stuff like that. There are certain, mentalities or taboos. Although I myself have not found much of taboos while I was doing the IDI. Maybe from that perspective, because it is not the girl who decide where the bathroom is supposed to be, it is the authorities. So maybe they have already made a separate place for that. During the menstruation, you are supposed to use these washrooms, and other days you're supposed to use the other room,
Okay.
washroom. Maybe that is something how they have it.
Okay. Now, excellent discussion. Thank you. And probably on just last point, probably.
Exactly.
You remember there was a very popular movie by Akshay Kumar probably 3-4 years back called as Padman. Yes?
Yes, Padman.
You must have seen that movie.
Yes, little bit.
And if you remember it, can you actually tell me, do you actually think the scenario has changed from that particular movie storytelling versus what the study you did today?
Sir, I haven't seen the movie in like thoroughly, so I'm not sure about that. But I would say one thing that from my study, there was a very significant finding that I found. I already mentioned, I would repeat, that there was 100% of the participants had used a hygienic absorbent. This is, I think, a very significant step, a very significant rather leap among this age group for prevention of very deadly diseases, very death, as well as very inappropriate unhygienic practices. So I think that has been a very big progress. That is my perspective that this is happened.
Excellent. So thank you, Dr. Oindrilla. We would be putting this up in the social media, and also we'll be trying to actually tag the Government of India, the Government of West Bengal, the Honorable Prime Minister's Office, the Honorable CMO Office, and also Akshay Kumar himself will try to put up a tag, because yes, the reason is you brought a very beautiful study. And more than that is probably the World Health Organization to understand that the 4 steps which we actually put up for menstrual hygiene, probably they should rethink on it and make it as a weighted score rather than just a plain arithmetic score. Because probably if it would have been a weighted score, probably the overall component in your study would not have come this low. So that is probably one thing which probably the World Health Organization can actually work upon that. Yes. Thank you. Really, I'm blessed to have this interaction with you. And also,
thank you. It's my pleasure.
And do convey my regards to Dr. Ghosh also, because ma'am guiding you, it was really fantastic. Yes. As a postgraduate, you get a support from your associate professor and your faculty members who are actually helping you in that. Yeah. So thank you. Bye-bye. Good night. Take care.
Thank you.
Okay. Bye-bye.
Thank you guys. Thank you for watching this exciting video. Do drop in your messages, your comments, or any improvement you would like to see, or any other topic which you want me to take up in the PSM resident course. This course, which has been running for almost last 1 year with almost 500 active subscribers across the country, PSM residents of the first year, second year, third year, plus even I do have senior residents and even some consultants, faculty members doing this course. So do not miss out on this. Please, please, please subscribe. And if you have any queries, do reach out to me. Your host, your dost, PSM said.